You're listening to Health Innovators, a podcast and video show about the leaders, influencers, and early adopters who are shaping the future of healthcare. I'm your host, Dr. Roxy Mooney. Welcome back to the show, Health Innovators. On today's episode, I'm sitting down with Dr. Talya Miron-Shatz, who is the CEO of Cure My Way. Welcome to the show, Dr. Talya.
Thanks for having me, Dr. Roxy.
It is good to have you here. So I like to start off by telling our listeners a little bit about your background and what you do.
Yes. So I have a PhD in psychology and I do medical decision making. Basically, I do research and consulting in how people understand medical information and what they do with it. So first you have to understand it cognitively, then you have to, understand what it means for you in terms of action. And this needs to be followed up by oh my God. Do you want to stop for a minute? Is this
Yeah.
PhD in psychology? Thank you. So I have a PhD in psychology. I'm a full professor, and in the University of Cambridge, I'm a visiting researcher. So that's where I stand academically. And what I do is I do research on medical decision making. I wrote a book on medical decision making, and I do a lot of consulting work on implementing everything I know, which means how do people understand medical information? People being your clients, people being your users, people being a combination thereof, or being the supervisors or the decision makers, who need to understand what it is you're doing, why is it great, and how to use it. Mm-hmm. So there's the cognitive element, and then there's motivation. And motivation means adherence to medication, to treatment, to using a device, because Fitbits and Garmin's, etc., are often deserted after 4 months. And that's by people who have actually been using them. Medication people take about half the time if you average it across time periods and medications. And these are things that you could say, well, the motivation should be inherent. I mean, it's your health. But guess what? These mechanisms still need to be built into the device, into the service, constantly, wisely. So when someone asks me, so should I bring you along like after I created the product to like a kind of a marketing team? And I'm like, you might want to bring me before you create the product, and let's think about what people will want to have in it, how they'll want it presented to them, how it needs to be designed so they can understand it. Because sometimes you have really great ideas, but if you don't convey them well, your users are not going to like them. And liking is actually super important, because in our world, in my world of behavioral economics and psychology, we understand that people think, but they also feel. And feeling is much more immediate and oftentimes much more powerful. So when you're creating something that's really smart for people, for their health, you might think, well, I don't care if they like it, but the truth is they need to, or they won't continue using it over time.
So on this show, we talk a lot about commercializing innovations, because it's a big gap in the market, right? We all get excited about talking about the sexy tech. But if we don't know how to commercialize it effectively, it won't get into the hands of the people that need it most. And, we won't be successful in transforming the industry. So from your perspective, I know my point of view of why I invited you to be here today, but from your perspective, how does your insights, knowledge, and practice, how does that affect the commercialization process?
I think it's key. I think you need to have, in our world, you need to have 3 key elements. You need to have the medical side, you need to have the technological side, and you have got to have the psychological side. It's crucial, because if you haven't dealt with it, then you're selling your product that people maybe are unsure of how to use. Maybe you haven't built in the trust mechanisms, and you can say, come on, this is funny. Like, you're almost talking about a relationship with a device, with a machine. You're being ridiculous here. Guess what? I'm not, because people will say, oh, I love my whatever. I love this app. I love this fitness watch. I love, people get attached to their iPads, their iPhones, their laptops, everything. It becomes very personal. And that is something that you have got to consider throughout.
I was at a conference years ago and I saw this little like robot thing that was a digital medication dispenser. And people were talking to it. They were supposed to, right? There was AI built in and they were talking to it. And the little device was asking the patient, how many doses they had on hand and, just kind of gathering some of that adherence information. And I had heard that they were befriending these robots and people were even starting to sell like clothes to dress them up in the whole bit because these were one of their friends now, this little robot that was in their home.
Yeah, I agree. We could think of it as some weird sci-fi innovation, but we can say there's a real need here. The need is for people to adhere to their medication. It's difficult because it's complicated. And that's the practical aspect. It's difficult because sometimes they don't understand or they get confused about the regime. And it's also difficult because it's not pleasant to take a lot of medication and you have to wait. And, it's a schlep and it's a constant reminder that you're not doing very well. On top of that, sorry, just to finish the thought with the robots, a lot of people get lonely. A lot of older people, senior citizens, they get lonely. And that's a predicament in and of itself. So the robot fills these functions. And I think it's beautiful. It's actually a great way to talk about commercialization, because you could say, well, what do these people need? They need their medication dispensed to them. And then you can take a step backwards and say, who are these people? They might be a little older. They might be a little lonelier. Maybe they have other needs, like the need to engage with someone, to have a nice chat with someone. And when you've layered this on top of the medical need of having to take your medication, people like it. They might even become addicted to it because it becomes a chat. And that's the emotional aspect that so wisely was embedded in the robots.
Mm-hmm. Yeah, very true. So, I want to talk about, so from my perspective, healthcare as a whole has been very much behind when it comes to marketing, when it comes to integrating psychology and marketing or psychology even outside of marketing, right? Whether we're talking about product development or marketing. And in my experience, very often when I'm working with companies, they're initially starting off with kind of I don't know that we even need to have these, let's say email marketing programs or communicate digital journeys with patients or with providers. And then if you can get them to kind of buy into it, even if they do, it's still kind of thinking of it as a one size fits all. So let's say, for example, we're talking about a business that supports many different therapies. Often I see that they're communicating with them like as patients as one homogeneous group. Or if they do any type of segmentation, it's like, well, these are our oncology patients. These are our hepatitis C patients, and they might separate them like that. But that's really the extent of it. And that's probably really sophisticated compared to where I think the overall industry is. And what I hear you're saying is that, which I completely agree with, is we've got to go beyond that if we want to be able to really be effective.
For sure. I think, and it's fascinating. I'm giving a talk next week to this, it's organizational training. So to a group of managers. This one is about behavioral economics. The next one is about what is success. So basically, how do you define your goals? And it's amazing because adherence to medication is at 50%. What's a goal? What's going to be success? Maybe you can increase it to 56. Maybe you can increase it to 55. And when you do that, you need to ask yourself, so what does it mean? Does it mean that the person who used to miss one dose a week now doesn't miss it at all, but the person who used to miss 4 doses a week still doesn't miss it? So we can refine our work. There is so much to say about what you said. The first thing is, back in the day when I was teaching consumer behavior at Wharton, one of the first things is about exposure. And that's really what you're talking about with the email campaigns. It's about telling the world, hello, this wonderful thing exists, because everyone is so jaded and everyone is constantly bombarded with information. And that's like the first thing. And the second thing that you said is truly important about segmentation. So when I think of it in terms of psychology, a lot of things come to mind, a lot of mechanisms. One of them is a personality variable that kind of became famous. It kind of became famous because it's called conscientiousness. And Angela Duckworth, also out of Wharton, created a similar variable, which she called grit. So grit, conscientiousness means I need to do this. I'm not enjoying it, but I will do it nonetheless because I need to do it. So if you're a patient and you need to do, for example, physical therapy, like you need to turn your arm around and maybe you just had surgery, 1, 2, 3, by 8, you're like, and maybe by 9 you're yelling and then the neighbors are like, what happened?
Right.
You're going to do number 10. You might be crying with pain, but you'll do it because you have the conscientiousness. So it's very possible that for you, you don't need to be boosted all the time because someone says, Roxy, turn your arm around 10 times, take the medication, use the device. And you're like, okay, I'll do it. And others are much less so, and you need to reinforce them. So that's personality-based segmentation. There is also segmentation based on where is the person in their journey. And actually, this is something that I'm constantly shocked at how missing it is from our marketing, from our patient support programs, because I do a lot of work with pharma and they spend a lot of money on patient engagement and patient, and patient support, and mostly with particular kinds of diseases. I mean, nobody does that around headache medication unless it's caused by something absolutely terrible. And there's always the question of how does the person feel about their condition, which can also be about something as mundane as diabetes. So is the patient understanding and accepting that they have diabetes and they just need to be informed? Or are they saying, this is stupid, or with high blood pressure, even worse, or, atrial fibrillation, you don't feel them. Double stupid, right? It's even harder for anyone to convince the person that there's something wrong with them. And obviously with atrial fibrillation, when there is something wrong with them, they've just had a stroke, so they don't want to get there. So you need to understand where they are in the journey. Are they in denial? Are they in resistance? How are you going to help them? How are you going to break this barrier? And I talked about, going up from 50% to 56%. What about those people who might be there on the side, never taking their medication at all, never using their device or their equipment or anything you want to sell them that could make their life better? Their life, I mean, your life, but also their life and everyone's health outcomes and their health systems, financial outcomes, everybody. Maybe they're saying, this is stupid. I don't need this because I don't have this stupid condition, and everything is so stupid because they resist it, and and you need to work around that. You're actually doing them a huge favor because pretending like you don't have diabetes, well, guess what? That could come back and bite you. And likewise, many of these conditions. So that's really another form of segmentation that you can only get to if you understand that this is an issue.
So I remember working with someone a long time ago. The way they were describing it was around like mind genomics, and it was kind of very similar to what you're talking about. It was this mind science of, if kind of just using the example of medication adherence, that if you have one message, that there's some questions that you could ask a whole patient population to kind of identify what buckets or categories they fit into, and then you'd be able to determine that this one message, if you put it in front of, let's say, 30% of that patient population, you would motivate them to do the behaviors that you wanted them to do. But if you put that same message in front of another 25%, you would actually get an opposite effect of what you were looking for. And how important it was to really be able to understand that and then customize your programs accordingly.
Right, exactly. So one thing comes to mind, and there's many more. One of the things is about the messages that pharmaceutical companies would always send or often send around aging. And they will show two graying individuals. They're a man and a woman, 99, no, who am I kidding? 100% of the time.
Come on.
A man and a woman, and they're getting older, and it's all about getting to see your grandkids.
Yeah.
Guess what? Not everyone is a man and a woman living together. Not everyone has a partner. What if someone's senior and you're just telling them, well, you're alone, which means you're not really who I care about. I care about people who are not single, or you're gay. Well, guess what? You're not going to see someone like you in a commercial. You're just going to see someone else, or you don't have grandkids, and maybe you're fine with it, maybe you're not, and someone's just rubbing it in your face and assuming. So that's another element, and these can be very hurtful. There's something else that I want
to. Who wants to think of ourselves with the gray-haired people, even if we are? That's offensive.
It is. It really is. So there's a lot of market research to be done, and there's also a lot of trust and understanding that need to be embedded into these campaigns. And it's crucial. So I was involved with a health agency, health advertising agency, who came to me saying, look, we tried something, and we tried a diabetes support program, and it's great. It's great. We're giving people glucometers. We're giving them support calls. Those were the main elements. And the company pays, obviously, but 6 months down the road, for every 100 employees with diabetes, you only had 8 on the program. That's not great, really, by any standard. And when we looked in the data and when we spoke with the patients, we understood, first of all, they got glucometers. Did they say they needed glucometers? Because, and that...
Just give me the free stuff.
It's like, it's going to innovation. Maybe you have something and it's working, and you really don't want to bother yourself with something new. And you could be a patient and you could be a doctor, because getting to know something new is a schlep, is a hassle. Where do I push the button? What does it mean? Why is this not working? Maybe because you don't know how to work it, but maybe you don't have the mind space to learn it. If you're a doctor, who can blame you if you're a patient? It's difficult. So you have that. So the glucometers sounded like a great idea, but they didn't really cater to a need. And the calls, people found them incredibly intrusive because they weren't onboarded properly. So you get a call and someone says, Dr. Roxy, I see your blood sugar level is going up. And you're like, who are you? Why are you calling me? Did I give you permission? Do I know you? And that's another
Especially
element.
In today's world, you're like, is this spam? Is this,
Exactly.
Are you trying to fraud? Are you trying to, just pull my identity factors from me?
Yeah, exactly. Yeah. So there's that, and there's something else. And it was funny because I read about it in the newspaper as a success story. So it was about this girl called Lexi, or young adult. I think she was around 20, and she had a fitness watch, and it wasn't working well. It was like buzzing in a weird sort of way for a few weeks. Now, that's how she interpreted what was happening. In truth, there was something wrong with her heart rate. So that was what the fitness watch was detecting. So technologically, perfect. Medically, wonderful. Psychologically, really not great at all, because she didn't understand what was happening. She let her mom eventually wear the watch, and the weird buzzing stopped. So they said, oh, so it's not that the watch is broken, what's going on? Then they realized, and they looked, and it really, I found it so symbolic that they said, look at this great success story, because when they looked into it, they understood that there was something wrong with her heart rate. They rushed her to the ER. Within a few days, she was operated on. It could have killed her. But it makes no sense to me that you have input that you cannot interpret. So there's no comprehension of the medical information, and there's no implication. So someone tells you your whatever is this high. What does it mean? What do I do? Should I rush to the ER? Should I stop having, pancakes? What happens next? And the next step is not there for liability reasons, for a bunch of reasons, which I understand. But if you really want to have an effective innovation, this is the next step, because then you're constantly giving people value. Constantly, you're giving them feedback, you're motivating them, I don't see that in a lot of the digital health applications that I'm exposed to. I see the medical side is wonderful. The technological side is beyond, and the psychological side is definitely lagging behind, but it is crucial for effective use.
Well, and it makes me think of a lot of the biases and assumptions that we have about people, where, in the example that you just gave, her being a 20-something-year-old, because she's young, she's a millennial, you're assuming that she understands technology. So you maybe don't even need to explain those things. And I think a lot of times we assume that if somebody's over 50, that they are going to be less tech savvy. So we kind of put people in age buckets and go, oh, you know a lot, you know just a little bit, you don't know much, or you're not interested, and just kind of have all of these assumptions about that. But it's not always tied to age. You're going to have some 20-year-olds that are not tech savvy, and some 50-year-olds that can run circles around those millennials.
For sure. And also there's something that's crucial to important. So that's crucial to remember. So when I wrote my book, Your Life Depends on It, what you can do to make better choices about your health. And since this is on video, you get to see the book.
And where can people find it?
People can buy it wherever books are sold. That's where they can find it.
Right.
On Amazon or anywhere, your local bookstore. Amazing. So when I wrote the book
for you right here.
Thank you.
Below. Yep.
Amazing. Yes. Read it and tell me what you think, you guys. I wrote about how difficult it is to be a patient, and how really it brings you down in a way that is emotional and cognitive. So I quoted, and it was a big hit a few years ago. It's a wonderful book by Paul Kalanithi, who was a physician, was a surgeon, and he had cancer. And he wrote about his encounter with a physician when he was a patient.
Okay.
So he knew more than the doctor who was treating him, but he was deferring to her. There was something that made him disempowered, made him feel powerless, sitting in that patient seat for once, like reversing seats, being scared, being anxious. So you could be a Nobel Prize winner, but when you have a pain and you're scared about it, and when you're sitting next to your spouse who isn't doing great, it doesn't help that you have the literacy level of a genius, of a brilliant person. It's probably safer to communicate with you at the level of a fifth grader, and to allow for a drill down. And actually, this issue of literacy, of health literacy, is crucial. So it's a simple fix, really. You just need to realize that you can't use technical terms or medical terms and assume that people will understand them, because I see some of the brightest people that I know stumbling upon these words because they just don't understand. But it's not on them. So it's on them. It's on whoever explains it to them. And if it's anything digital, it has to be clear, and we can't assume that things are self-explanatory. I worked with a company that let me try a glucose meter. I said, it couldn't work, kid. I tried. It was super frustrating. So it's intuitive. Is it?
Yeah.
Really? Are you sure? I don't know. Well, maybe it is for some people, and that's great. Maybe it's not for others. So help them with words and with instructions. And really with never putting the onus on the person. The onus is on the person to use it, to do their best. And it's on you as the developer to make sure that they understand, that it's clear to them, that it's not super frustrating, that they understand the language, the use, the implications. One last thing about this, I have a great colleague from Finland, and we looked at mobile phones. We looked at people when they were switching into smartphones. Yeah. And we saw that they understand that getting a new phone and learning it takes time, and it can be frustrating. So that's okay. There's a learning curve, and people take that into account, but it can't be too steep.
Hey, it's Dr. Roxy here with a quick break from the conversation. Are you trying to figure out what moves you need to make to survive and thrive in the new COVID economy? I want every health innovator to find their most viable and profitable pivot strategy, which is why I created the COVID Proof Your Business Pivot Kit. The Pivot Kit is a step-by-step framework that helps you find your best pivot strategy. It walks you through 6 categories you need to examine for a 360-degree view of your business. I call them the 6 critical pivot lenses. As you make your way through this comprehensive kit, you'll be armed with the tools, tips, and strategies you need to make sure you can pivot with speed without missing out on critical details and opportunities. Learn more at legacy-dna.com/kit.
Let's kind of just have a little imaginary situation here where you're working with someone who is a health innovator, and in a perfect world, they are open to all of your expertise and they have the resources to have you throughout the journey from end to end, wherever they need you, and to be able to implement all of the ideas that you have. What does that look like? What are some of the strategies that health innovators need to consider or deploy in order to increase their likelihood of commercialization with people? Because we're talking about patients a lot, but really this is applicable to any group of people.
Right. The first thing, I guess, is to understand what the burning needs are. Not what you know to do technologically, but what the needs are. Because if you have equipment that caters to a need that's already being catered to, then you need to have to give people a really good reason, whoever will be using it, be they physicians, technicians, and their healthcare executives who need to pay the bill, what is their need? So is it going to shorten the queues? Is it going to be shiny and look amazing and no one else will have it? Because I worked with this company once that created something for eyes, and they could send patients home back in the day with CDs, or you can send them with something. You can give them a clip. You can a TikTok. God knows what they'll come up with next. But if you cater to a medical need that's already been catered to, then cater to some other need. Cater to the coolness need. Cater to the need of, this is something I can send to patients and they'll understand and they'll prepare better, say for surgery or anything, which will save me time and reduce the amount of no-shows and reduce the amount, say, in colonoscopies. Between 25 and 35% of patients who come in are sent back home because they haven't prepared well. So we know how to do colonoscopies, right? But if you create something that caters to the need of reducing the no-shows, that's great. So understand the needs. I mean, it's a little bit of use the other person's perspective. I guess it's not just to be in love with your own technology, which you absolutely should be because it's your own technology, but also to really not be super angry when someone says, well, I already have that does what you're doing. And well, you would do it better. Okay, amazing. But what's their reason for using it? That's one thing.
I just want to let all of our listeners know that I did not pay you to say all of this. This is like one of my soapboxes. Like it's so sad on how many people are starting off with tech and not starting off with real validated needs. This, entire business models built upon assumptions, and it's just a recipe for disaster. So I really, really value and appreciate that you're reminding the audience the need and the purpose of that.
Thank you. I appreciate it. And, it's not that I don't completely value technology. I absolutely do. I just know you can invest so much time and so much money in creating something that then is not bought. And that is incredibly frustrating. Really, nobody wins from that at all. Another piece, and it diverges, is to make sure that use is simple, is clear. And it diverges because this applies to patients and it applies to physicians or any kind of healthcare providers. that might be using the device. I mean, are they smart? Of course. Are they overwhelmed? You betcha. So how do you prevent these overwhelmed, albeit smart people from saying, yeah, I don't want to deal with it? It goes back to the needs, but once you can supply them with this wonderful technological innovation, you also have to make it very clear for them how they're going to use it. Something else that I saw, and I saw it a lot with medication, is that you need to convince people, and you need to convince people in a number of ways, and probably to create awareness before you start selling. So again, I'm very familiar with the pharmaceutical world, also with the device world, but with the pharmaceutical world, it's very organized because your target audience is very clear. You sell the medication to cardiologists. You bring in a shiny advisory board of cardiologists with their sports cars. They're very alpha. It's like, whoa, it's a very specific kind of energy to be in the room with them. And you have to talk to them, and you have to enlist them, and you have to get them to use whatever it is you want them to use. And you have to understand ahead of time what their objections might be, and to try to pull them in together. Again, this goes into, what do they care about? They care about doing a really good medical job. They care about doing cutting edge things. They're kind of fearless, but they're also risk averse. I mean, they don't want to kill people because they use the shiny new device or technology. So you have to reassure them on one hand, and to cater to their, I almost want to say, desires on another hand, because they really are ambitious people, and they have these wishes that you might be able to help them accomplish. So that's another type. Then you have the whole aspect of health literacy, which I know it sounds like a snooze. It's like, I don't care. I'm on and you keeping it real, right? Health literacy is not the first thing. If we were going to a health tech innovation conference, the health literacy session would not be the one that's filled. You could get a good seat, right? But if you call it how to make sure your patients get it right, use your product, don't store it in the drawer or return it to the store or complain to their doctor about that thing that's not working, that's going to make a huge difference for you. Huge. And if you're selling anything for healthcare providers, likewise. So again, you said, and I love it, you said that in the context of personality. Don't assume that everyone's the same, that everyone likes the same things or has the same aspirations. And don't assume that everyone can understand what you're saying, because you might very well be wrong. And then they'll blame your product. They'll blame you. And guess what? It's going to be your fault, because this really is on you. It really is an aspect that you need to deal with.
So there's a couple of questions that come to mind that I'm sure the audience is thinking is, how do you identify those different characteristics or differences? And then even if you could identify them and kind of put people in buckets, if you will, how do you operationalize those kind of personalized experiences, especially at scale? What are some of the examples of the work that you've done and how you've addressed some of those things?
So I think when you do things at scale, sometimes you use brute force. But when you use brute force, you can do that by incorporating mechanisms that will apply to as many people, and also by removing as many barriers that will deter people from using your product. I'll give you an example that's related to trust. And I mentioned trust, and we talked about schemes in the beginning, kind of jokingly, but I worked with a company that wanted to create a new model for healthcare insurance. And their idea was to give you a credit card of sorts, not really a credit card, a health credit card. To get it to work, you had to put in your credit card info, your own credit card info. And I was working with them. It was fascinating because I was working with them on their mock-ups. I mean, they hadn't even programmed anything. They just sent me all their mock-ups, and I spent a great many happy hours going over these, which was fantastic because the cost was my time and they're redesigning their mock-ups. Imagine that it happened when the product came up. So I noticed, for example, that they ask you to put in credit card info. They don't explain why. And they don't really create anything that would elicit credibility or trust.
Yeah.
So I thought the average user would say, who are these people? Why should I give them my credit card info? Not do that. And then you go to the doctor, you have the credit card, it's not working. You have the health credit card, it's not working because you didn't connect it with your credit card.
Right.
So that's the sort of thing that you can do at scale. And more importantly, it removes a barrier. Now, barriers are so important because in psychology, we know that bad is stronger than good. If something bothers you, but has some advantages, you're not going to use it. You're not going to do it. If something has maybe fewer advantages, but there's nothing about it that bothers you, it stands a better chance. So that's the sort of thing you can do at scale, which is crucial. It's basically crucial because if you don't trust, you're not going to use. Other things that you can use, again, with marketing, if you go and you segment and you can work in buckets and you can identify who belongs to which bucket, then you can definitely include and incorporate the specific and unique motivation.
Yeah.
And if you can't, again, you use blunt force, which is also great because, for example, if you know that people care about being connected with emotionally, then you'll do that. And you'll include that. And some people more so than others. So you don't want to go overboard. So you're not deterring, but you have to create some sort of a connection. And that's crucial. It's crucial when we meet our doctors. If you don't feel that the doctor knows you as a person, you're less likely to take your HIV medication. Can you imagine? And it can go south if you don't take the medication. But you feel no connection, you feel no care, not good. So this is another point that's crucial and is often just left out.
Yeah.
Which is not great. And I love that you talked about the robots because someone who designed the machine designed it with a face. It has a sweet round face. They thought about it. They wanted me to look at it and smile. And to I don't even know if it's anthropomorphization when it's a robot, just a person.
No.
Exactly. It's not an animal. Just pretend like it's human.
It's no longer an inanimate object. It's animated.
Exactly. So someone thought about it and threw that in. And the last thing I want to say about that is you want people to use things over time. So plant the seeds for that. If they've used something for a week or 2 or 3 or 4, after 4 months sounds like the magic number. And I'm getting it from a lot of places and platforms that do adherence and with the fitness watches, 4 months, you're like, okay, I'm out. Like, been there, done that. But you don't need to do fitness anymore. You don't need to adhere to your medication anymore. I don't think so. So
well, and just ask Facebook, right? How long did they need to keep us engaged? Indefinitely. How often are they coming up with new engagement tactics and strategies? Always. It just never ends unless you want people to just start dropping off.
Exactly. And Facebook has it easy in the sense that your friends always do cool stuff and there's always stuff to read and stuff to respond to. Not that Facebook are just sitting not doing anything. But this also happens, and it's the absolute opposite of most things medical, which are also not rewarding and not fun. So you have to understand that this is really important for your health, is for some people a good enough motivator. And I mentioned conscientiousness, and for others, just not enough, especially since they take the medication and nothing is happening. Not really, but in their mind, nothing that they can feel. So this is the type of things you need to be aware of.
I think we underestimate the value of community around healthcare. So we've got a lot of these healthcare communities, right? Like patients like me, but these are things that are like separate healthcare communities, not necessarily all of these innovators thinking about how can they build community within their solutions so that they have that inherent ongoing community engagement, that they don't have to do all the heavy lifting like Facebook.
I agree, but I also think it's tricky. I mean, if we think of personalization, and I know this from doing some work with patients like me, actually,
Yeah. Okay.
that the majority, I love them and I've been in touch with them since 2009. I've been working with them recently.
Okay.
I know that the majority of people are passive. They'll come, they'll show up, maybe they'll read, maybe they'll ask a question, maybe, it's like when you buy shoes on Amazon, or what did I buy? About whatever, you buy something on Amazon and then they send you a question. So you might be very timid, but they say, Roxy, how long ago, did the heel break? And you say, no. You just answered the question on Amazon, but someone fed it to you. Someone gave it to you. So you're more likely, if you're shy, you're more likely to do that than to contribute content. So actually creating a community is a skill. Creating engagement is a skill. It's not just going to happen. It's something you need to think of.
Like 80% lurkers. Like you only expect 20% of the people to initiate that engagement, right? 80% are just kind of wandering and reading and observing and not really engaged, but you would never know that because they're not initiating those conversations.
Yeah. Exactly. So you have to lure them in. You're almost like a kindergarten teacher and saying, what's your name? You're like, Roxy, what did you have for breakfast? And then and it's hard. It's a little bit like pulling teeth. So just to say, here, kids, here, patients, gather around and you can talk amongst yourselves. It doesn't always happen. Sometimes you need to make sure that there's value that you're giving them when they're engaging. It's almost like everyone is going to be sitting on the lawn because you provided the lawn and the blankets and the popcorn and the movie. And then they're together. Maybe they're not talking to one another, but they're all together having a shared experience and something might happen. But you can't just say, well, here are some people, they should get together.
Right.
This really needs to be nurtured and created and fed into. And I know that people also get very frustrated. If they go on a platform and they ask a question and nobody answers, they're like, that was useless. And they're never coming back.
Right.
Now, this is painful. You want to create a community, then think of, what am I giving this community? Don't just think I'm giving them an opportunity to communicate, because there are multiple mechanisms around that.
Yep, it doesn't happen overnight, that's for sure. So as we wrap up here, I just want to thank you so much for the time that you spent and just really being able to have this very, very important conversation. I feel really strongly that this is one of those key ingredients that are missing from most companies, from most healthcare innovations. And so I really appreciate you being here today. How can folks get a hold of you after the show if they want to follow up with you and get more information?
For sure. So my name is Talya with a Y, Miron-Shatz, Miron-Shatz. My website, surprisingly, is talyamiron-shatz.com. So if you go on it, there's a contact form. There are links to my multiple webinars and talks, including the one at the American Telemedicine Association recently, webinars on behavioral economics, a lot of good information, a lot of information about my book, Your Life Depends on It, what you can do to make better choices about your health, and about the work I do with companies, with various companies, from pharma, from corporate, from multiple startups, health advertisers, etc. So Talya with a Y, Miron-Shatz.com, and I look forward to hearing from you. Thank you so much for having me, Roxy.
Thank Thank you so much for listening. I know you're busy working to bring your life-changing innovation to market, and I value your time and attention. To get the latest episodes on your mobile device automatically, subscribe to the show on your favorite podcast app like Apple Podcasts, Spotify, and Stitcher. Thank you for listening, and I appreciate everyone who shared the show with friends and colleagues. See you on the next episode of Health Innovators.